Welcome to DM Neurology Made Easy. This is the 22nd episode of Fine Neurophilia Quick Revision series. Let's see the Parkinsonism Part 3 video. In Parkinson's disease, Parkinsonism can also be seen in dopa responsive dystonia, a condition that results from mutation in which of the following genes? Dopa, some dystonias are dopa responsive, that is DYT5, otherwise called Sagawa syndrome. This is due to GTP cyclohydrolase 1 deficiency. So any patient coming with Parkinsonism less than 20 years of age, so the young onset Parkinsonism, that is YOPD, you have to investigate. It is not that Parkinsonism mean age is actually 60 years. So if any patient coming less than 20 years, we have to think and give a trial of dopamine, that is dopa responsiveness, because it may be not just dystonia the patient may be presenting with. It can also have, patient may also have Parkinsonism. That also we have to think in mind. So which is the most common cause of familial Parkinson's disease? So genetics of Parkinson's disease is also repeatedly asked. Genetics, there is a table in Harrison, there is a big table in Bradley. I think better at least you read about table, you finish the table in Harrison, because repeatedly asked about genetics of apart from the anti-Parkinsonian medications, the most important topic is actually genetics of Parkinson's disease. So don't leave or skip the topic of because it's be confusing for you. Don't skip the topic. So the answer is LRK mutation. So less than 40 years, you go for genetic testing. And which are not following inherited Parkinson's disease has an autosomal dominant inheritance? So we have to study about dominant and recessive type of Parkinson's disease. The most obvious answer I haven't put in the MCQ. So that is why some may find it difficulty and get confused. Kupffer-Rakib disease, this is also there in the table. That is Parkinsonism with dystonia is due to mutation in. So this is the table I was talking about. So Park ATP13A2 is associated with Kupffer-Rakib disease. And this is the autosomal dominant PDs. Early onset are mostly autosomal recessive. So autosomal dominant most commonly, like usual MCQs, in my exam, that is about 6 years back, they asked this same question. Autosomal dominant, I had like this LRK2 was the MCQ. I remember the option, that is LRK2. So that's why I didn't keep it purposefully. The answer was SNCA, autosomal dominant one. So this table is important. Which of the following is an incorrect statement? So one of the side effects of this dopa medications, this levodopa. Levodopa is usually given just because of the reason that it causes like to cross the blood-brain barrier, and directly if it given, it causes what called the side effects. That is basically this nausea, vomiting, postural hypertension, etc., are due to the area prostroma, that is the CTZ, chemoreceptor trigger zone stimulation. So that is what happens here. So most of them have 75% have got it correct. So reserpine blockage was initially, it's actually the experimental model to produce experimental Parkinsonism is produced by injecting reserpine into rabbits. That's how it's there in Harrison actually. And dopamine does not cross the blood-brain barrier directly. That's why you use the levodopa. And dopamine receptors in the area prostroma are not protected by blood-brain barrier. That is why you get vomiting and all. And levodopa usually should be started at low doses and gradually titrated to avoid the side effects of levodopa. So these are taken from Harrison. That is why we give levodopa with carbidopa. So that this peripheral decarboxylation is gone and more of brain levodopa reaches the brain. Which of the following is a second generation non-ergot dopamine agonist? So read the question carefully and try to answer this. So we have multiple types of medications for Parkinsonism. So most commonly and widely used and useful one is the levodopa. Then comes the dopamine agonist, which are of two types, ergot and the non-ergot type. Then comes the COMT inhibitors, the COMT inhibitors. Then the MAO inhibitors can be non-selective and selective. Anticholinergics, that is triexphenadil, etc. Then even amantadine, etc. can be used. Then newer ones, apomorphine, dopamine agonist, then like that, multiple kinds of medications are there. So which of the following is of this dopamine agonist, which acts on the dopamine receptors, which is the second generation one? So read this carefully and try it. Most of them have got that correctly. So roticotin, you must have known that there is a roticotin patch is there. Rest of them, bromocriptine, pergolide, and cabergoline are actually first generation. So those increased dopamine like levodopa, amantadine, stimulate receptors include ergot and non-ergot ones, and anticholinergic drugs include the others. So this is actually the chart which shows the ergot and the non-ergot. If you can, this is actually there in Harrison. The scenario was made by me. It's an artificial scenario. I think this could happen, so that is why I made the scenario. It could be asked also. So try to answer this question. The patient is dosing off without any clue or without any premonitory symptoms or any yawning and all. The patient just doses off without any clue. So that is usually occurs with dopamine agonist. This usually occurs with dopamine agonist. So this is actually that pramiprazole or propinerol. So the patient can have hallucinations, sleep attacks, orthostatic hypotension, as well as the patient also can have gambling and other impulsive disorders. So impulsive disorders, this sleep attacks or what you call somnolence. So these people are taking dopamine agonist are asked not to drive in the night or drive with when they are tired. So which among the following is a reversible MAO-A inhibitor? I'm just checking your attention and how you read the question properly. Are you reading the question properly and all? So try to answer this question. So I know you would be expecting this question on safinamide because it is the latest drug. I know that, but I wanted to tell you that okay, that is safinamide is the latest drug. Which okay, most studies are there. Indian studies are there. Dr. Rupam Borgain, sir from Hyderabad had done the study. We are proud that he had come up with the study from Hyderabad. He was my external examiner also. Which among the following? Actually, I was asking regarding MAO-A, not MAO-B. So actually, MAO, we were using non-selective ones. Then we came with selective ones like selegiline and rasagiline. But these selegiline and rasagiline are actually selective ones, but are irreversible. And safinamide, as you must have thought, actually is a reversible MAO-B and not MAO-A. MAO-A are actually involved, usually used in case of psychiatry as antidepressants, etc. And MAO is actually one of the disease-modifying drug in Parkinson's disease. So if you are asked a question on disease-modifying drugs in Parkinson's disease, it is actually MAO-B inhibitors. So you must have learned about cheese reaction and all. So moclobamide is actually a MAO-A reversible inhibitor. And as you have rightly thought, but not read properly the question, MAO-B is actually safinamide. You start with a dose of 50 milligram and later uptitrate 50 milligram OD. It's very useful, actually very useful drug. We use the drug Safinact for that. So which one of the following is the anticonvulsant, one of the anticonvulsant which we use as a anti-Parkinsonian drug? So actually the studies on zonisamide has come in Japan, which shows that zonisamide has anti-Parkinsonism, Parkinsonian effects. So this is directly taken from Harrison. So purposeful stereotype behaviors such as assembling, disassembly, or collection and sorting of objects in patients taking high-level doses of levodopa is better termed as. It's actually purposeless behavior. Do you know any other drug which causes this kind of behavior? I think chat, you can answer in chat if you want. Any other drug which was initially this drug, that drug, this an abuse drug, which was found to have this kind of punting behavior, punting. Amphetamine also causes punting behavior. And what is this Ondain's curse and all? You must be knowing, like. Carphalangia is associated with the Thura poisoning. Ontain's curse is actually a central hypoventilation syndrome. Ontain was actually a nymph. The story, German story, you must be knowing. Central hypoventilation syndrome, FOXB gene, and all. Dopamine dysregulation syndrome is another dopamine related syndrome. So all these are there in Harrison, page number 300 and 3127. So this question. So which is the only anti-Parkinson's drug which improves the dyskinesia which is induced by levodopa? This is a neat question. This is actually amantadine. So a lot to talk about this Parkinsonism medications. This is not enough. We'll be talking. The most hot topic in Parkinson's disease is actually not our circuitry or indirect or direct pathway and all. It's actually Parkinsonism drugs, most high yielding topic. And then comes the genetics, then only comes the circuitry. Circuitry is for the better understanding of the topic. So if you get the circuitry right and all, you'll be able to learn the topic with more enthusiasm and fun learning of Parkinsonism. And also the hyperkinetic movement disorder will be you'll be able to learn that part also with enthusiasm. So next class is actually hypokinetic disorders, movement disorders, advanced. So do not miss. More on PD, other disorders of hypokinesia, that is MSA, PSP, CBGD, DLP. More on drugs and studies on PD, that is lots of studies, Adagio, Datatop. Deep brain stimulation is a recent topic. More questions could be asked, especially in institutes. Newer therapies, stem cell therapy, other therapies, A2A, antagonist, agonist, etc. will be discussed. Harrison, you cover. Bradley, some parts, tables, try to read.